and good afternoon, everybody. I'm Bill McGinty. We're following breaking news right now. Mecklenburg County health officials holding a press conference about the coronavirus. We know there are 2 confirmed cases in North Carolina. Let's listen in to see what they have to say.
So at this point in time, we do not have community spread in Mecklenburg County or in North Carolina. That's the good news. There are 2 words that I want to use today for our community that I think will go through all of the talking points that I have today for you. The first is calm. We need individuals in our community to try to stay calm around this particular situation. We recognize that this is scary, it's new, and it has the potential to be wide-reaching in our community, but the worst thing we can do at this point in time is panic. We need individuals to be calm and to do what they can to support themselves and their families and to protect themselves and their families. The second word is caution. Although I want them to be calm, I also want everyone in the community to be aware of the situation and to be taking the steps that they need to take. So I will reiterate that the county and public health and all of our community partners are working together with preparedness plans and meeting regularly to make sure that we are ready to address the situations as they occur in this community. We recognize the fact that this could be wide-reaching at some point. We recognize the fact that our systems could be stressed at some point, but we're doing the best we can to plan for that and to have contingency plans in place if needed. We'd also like to remind individuals that if they have symptoms of fever, cough, or shortness of breath, with travel, especially with travel from areas of concern, that they should call their medical provider first or call the health department first before they seek care. That's to make sure that we are not moving infected individuals into the broader community of the hospital or an urgent care. They are set up to accept people who may be coming with symptoms, and if we alert them ahead of time, then we can prevent further spread within our hospitals or urgent cares or doctor's offices. So please make us aware if you feel like you have those symptoms and that you feel like you're at risk. We will make sure that you get where you need to go, but we'd like to be alerted ahead of time. In addition to that, we also want to make sure that if you are sick enough to need to call 911 to go to an emergency room, please alert the 911 dispatcher when you call to make sure that they are aware of the situation so that the responders can be prepared to protect themselves. We need our responders to be healthy and to be able to respond, and that means they need to be protected as they're going into homes. So when you are calling 911 and you have symptoms of a fever, cough, shortness of breath, and the potential of some travel, please let the 911 dispatcher know that as well. There's been a lot of discussion nationally as well as locally about testing. We do have more testing available than has been, but it's still limited. We want to make sure that we are providing this testing to those individuals who really need it. At this point, we are not recommending testing of individuals who do not have symptoms and who are not at risk. So the testing is being requested by physicians, and we also want people to know that if you are tested, you will be expected to isolate until those test results come back. So if you're not ill enough to be in the hospital, you'll be expected to be isolated at home until the test results come back. At that point, we'll determine further care that needs to be provided. There have been a lot of concerns about travel and whether people should be traveling or not. I want to remind everyone who is most at risk in this situation. We are looking at individuals over the age of 70 and those people with underlying health conditions. Those health conditions can include diabetes, heart disease, renal disease, kidney disease. Those are people that we're most concerned about. Those are the individuals that are dying from this infection. So when you think about travel, number one, you need to think about the places that CDC has recommended that you avoid. Those are on our website and the CDC website. Number two, if you're traveling, you may be a healthy young individual and expect to be able to come home if you're infected with minor symptoms. But say you live with your grandmother, or say you're a caregiver for an elderly individual. You need to take that into account. So we're asking people to use good judgment. There's no huge restriction on travel at this point from the CDC's perspective, other than asking people not to go to those countries that are at most high risk. But we're asking each individual to think strategically about the travel that they're involved in and making sure that they're not putting themselves or others unduly at risk. The county has a web page that we update daily. If you go to the county website, you will see, or you go to the public health website, you will see access to this information. It has specific information about the disease and about all of the things that I'm talking about, but it also provides you with links. And those links go to the CDC website, the guidance that CDC has provided on a number of different issues, as well as a couple of posters and some frequently asked questions that we have developed and have posted on the website. Those posters can be downloaded. They can be used as flyers. If you are in a situation, whether it's at your church or you provide a service to the community, of people coming into your office, that information can be provided widely, and we appreciate your help getting that out. In addition to that, we have an information line. That number is 980-314-9400. That number is for individuals, healthcare providers, the media, and the community at large. You will be routed to the appropriate person to answer your questions and to give you the information that you need. At the county level, we're also working internally to revise our county travel recommendations and also to prepare our staff. We want to make sure that we're supporting our staff and staying healthy so that they can serve the community and protect their families, but we also want them to protect the individuals that they're coming in contact with on a daily basis as they go about the county business. So we are providing specific guidance for our staff that will be posted on our website as well. We want to remind people how to protect themselves. There are 3 layers of protection. One is individual protection. We have talked about this a lot. We want to make sure that if you cough into your sleeve. I'm still seeing a lot of people coughing into their hands. That's something that we've done since we were kids. Use your sleeve, not your hand. Recommending that people aren't shaking hands these days. If you need to acknowledge someone else, you can elbow bump or you can nod your head. You can do whatever you need to, but shaking hands is not recommended at this point. We want to make sure that people are staying healthy, so getting plenty of rest, reducing stress, making sure that you're eating well, taking care of yourselves. All the other things that we recommend for each individual that is part of their responsibility in protecting themselves and their community. The next level of protection is at the community level. And there's been a lot of conversation about social distancing and about whether or not people should be canceling meetings or whether they should be canceling large events. At this point in time, we do not have any specific guidance from the CDC on canceling large events or restricting the size of meetings. Some businesses, some departments, some organizations are doing that. They're doing that on their own as a precautionary measure. We support them in that, but we are not recommending that at this point based on CDC guidance. That could change at any time, as could any of the guidance that we're providing. The last level of protection is the environment. So making sure that your environment is clean. I know that all of the Clorox wipes and the Purell are off the shelves. It's hard to get that type of equipment, but you can make a solution of 1 to 10 Clorox to water. That cleans just as well. So making sure that your environment stays clean and that you're keeping your hands washed. We've got specific guidance that we'll put out there on washing hands to make sure. But there's lots of videos on YouTube to tell you how to wash your hands. We want to make sure that people do that. Soap and water is your best bet. I just want to once more reassure our community that we are at low risk. We are going to keep you informed and updated as things change, and we know they're going to change. So I would urge calm and for people to do what they need to do to protect themselves, but not to panic at this point. I'll be happy to take any questions you might have.
Has any county employee recently been sent decided to go home on their own because they were showing possible symptoms? Anything of that sort?
Not that I'm aware of at this point. I want to remind people that we're still in flu season, and it's also, everything is blooming outside right now, so lots of people have hay fever. The things that we are concerned about with our employees is making sure, number one, that we don't have anyone at work that has a fever. And if someone is having difficulty managing their cough, even though they may not be infectious at this point, we might be recommending that they go home. We have not had any employees that we're aware of at this point that we've been concerned about coronavirus.
Are you concerned that those who do not have paid sick leave will be going to work when they should not be?
That's always a concern, obviously, and it's not something that is fixable in the near future, unfortunately. But again, I think people need to use their best judgment. Right now, again, we do not have community spread in Mecklenburg County. So we have seen quite a few people who have been very ill from the flu this year. So that's of concern as well. So as much as people can stay home if they're ill, keep their children home if they're ill, that's what we're recommending.
Reports out of schools.
If an employee was to be showing symptoms or something of that sort and was asked to go home and quarantine, would they have to use their own sick time?
At this point, it depends on the situation. We're handling every one of those situations individually. Depends on the situation. If the individual's sick and they're going home because they're ill, then they should, in the county, they would be using sick time for that. So again, that depends on the business and how they work with their staff on sick leave.
Some reports that school restrooms don't have enough soap, and the drinking fountains are gross. Are you all doing any extra inspecting or anything in schools?
We're not doing extra inspecting at this point, but we are working with the school system. They are operating under specific guidance from CDC on how to clean and to make sure that the environment for their children is as safe, and for their employees is as safe as it can be. So we're continuing to have those conversations with them about how they clean, what they clean with, and how often they clean.
You said testing. Has there been much testing?
There has been some testing. Obviously, we have not had any positive test results at this point. At this point, though, we are being very careful about who we're testing to make sure that typically what happens if an individual comes in, has the symptoms, we will work with the hospital systems, doctor's offices to do a respiratory screen first to see if there is another reason for the illness before we go through with the testing for coronavirus. And that's specifically because of the limitations with our testing at this point.
Did you say you've tested dozens?
To be perfectly honest, I don't have the whole numbers right now.
Is this testing at the county level or at the state level?
It's at the state level. It's at the state level. We also have several private entities that are testing. But again, the testing is limited, so we're, again, not recommending testing of individuals that are not symptomatic, and also that they're screened well before we recommend testing.
In other places, presumptive cases have been asked to either go to hotels or motels. Some places have even set up tents outside of ERs so that patients don't walk physically into the hospital. Are there any conversations about where we would send people or what we would encourage people to do so they're not walking into public places?
There are varying recommendations. That's a tiered approach. We are working with the hospital systems to make sure that they're notified before somebody comes into an emergency department. They have specialized rooms set up. They have a different entrance set up for individuals that we may be concerned about as a way of preventing exposing the entire emergency department. Urgent cares are doing some similar type of situations. The challenge we'll have, because 80% of individuals with this infection have mild symptoms. They do not need to be in our hospitals. Our hospitals are going to be plenty busy without that. So individuals may be requested to isolate or quarantine at home. And for those individuals who are not able to do that, we are looking into other options in our community to be able to provide them with the the opportunity to isolate and quarantine themselves.
As much as you stress no worry right now, you're still at the same time saying we're going to get cases. We may get a lot of them.
You know, this is an active community with lots of people coming and going on a daily basis. I do not believe we will come out of this with no cases. I don't think that's an option for this community. What we are saying is that we're doing our best to be as prepared as we possibly can when that happens and to be able to manage what comes our way.
What's your biggest worry?
My biggest worry at this point in time is panic. I think that panic could make for real challenges in our community. Number one, people overstocking so that individuals who need access to food aren't able to find it. I'm not suggesting that people don't stock up, but let's be reasonable about that. And the other issue that concerns me is people not following through on guidance because they're either not taking it seriously or they're panicking. So that is probably my biggest concern at the moment.
Besides recommendations, does the county have any role in making sure that testing supplies are available and also supplies like masks, for example?
So the testing, right now we are getting limited testing kits from the state. We do have the opportunity to work with private vendors if we need to. The hospital systems are looking at the possibility of testing. So I think that is going to improve over time. It's just at this point in time, we're a little limited with that. So the county will receive some test kits from the state, and we do have other supplies that we can use to test. We don't, actually what we would do is collect the specimens and send them to the state or to a private vendor to be tested. So we are working on that. The issue of masks, I will reiterate, people without symptoms who are not ill do not need to wear masks. In most cases, it probably makes things worse. Have you ever worn a mask? Do you keep your hands away from your face when you're wearing a mask? You're probably touching your face more often. You're possibly exposing yourself more. And the type of masks we're talking about don't really provide good protection. So people are walking around with a false sense of security. So we are not recommending masks at this point. The masks that we use in the healthcare setting to protect healthcare providers who are taking care of ill people are a specific kind of mask that's specifically fitted to their face to make sure that it provides the protection they need. And those are critical for our first responders as well as our healthcare providers to have availability, and so we're doing our best to make sure that others aren't taking advantage of those masks when they really don't need them.
The city of Charlotte is supposed to have a St. Patrick's Day parade on Saturday, and there's all these other events going on, March Madness, and on any weekend there's a lot of events that go on. So is the county making any recommendations for a lot of these group gatherings that are coming up?
We are not making any recommendations at this point. There has been no guidance from the CDC on canceling any type of events. Outdoor events are probably going to be easier than indoor events just because there's more air and you're not as exposed. I think each individual is going to have to make their decision about whether to attend those kinds of events at this point. Again, we don't have community transmission here. I want to reiterate that again because that is when we start having concern about those type of events. So right now, no recommendations. We're awaiting guidance from the CDC about what to do with that. I know in places where they have had sustained community transmission, they have canceled events, but right now that's not an issue for our community.
Are there any county employees that recently traveled either with family members and are now quarantined because they were showing symptoms?
We don't have any county employees in that category at this point in time.
Can you tell us what it means when you say that North Carolinians are still at a low risk for this?
Because we don't have community transmission, because we're not seeing it being passed from person to person just in a general community setting, we are designated by the CDC as low risk. We've only had 2 cases in North Carolina, and both of those cases had specific exposure that we were able to point to. Community transmission means you probably don't have any idea where you got it. Could have been at the grocery store, could have been in any setting that you were in. It could have been at work, at church, in any location, and that has not happened in our community yet, and it hasn't happened in North Carolina at this point.
So there's been no community transmission, but there are going to be headlines today about a patient who flew through Charlotte Douglas. What do you tell people who are saying, should I not be flying, and could we now be concerned that there could be community transmission since there was a possible patient who flew through Charlotte Douglas?
Okay, so we are going with CDC guidance on that particular individual. What we understand is that that individual returned from Italy, was not symptomatic at the time that they disembarked at the airport. It was a day or two after they went back to South Carolina before they started showing symptoms. CDC is not recommending any follow-up with anybody that was on that plane or in the airport at this point in time. They do not feel there's a risk there. So, but, you know, that's going to happen at some point. We know that's going to happen at some point. We have individuals flying back from a number of different venues where there are cases every day into Charlotte. And we recognize that that's the situation, and that's why when I say I don't think we're going to escape having cases in this community, because at some point that is going to happen.
Is there any extra strides to give resources such as soap or hand sanitizer to our homeless population?
We are having specific conversations. The county staff are working with those who provide services for the homeless about what kind of response they need to be having at this point. So we're working with them on that and on their response plans. I don't know that there's specific effort at this point to put that out there other than within the shelters. But we are working in that direction.
What about our inmates in our jails or visitations when it comes to visiting
Mm-hmm.
inmates?
We're also having those conversations with the jail, with the sheriff and his staff about any, at this point, there are no restrictions on visiting. We are having conversations about whether they start asking specific questions of individuals as they come to visit to determine whether someone may be at risk and should not be allowed to visit, but that decision has not been made yet. So we are working with them as well. In addition to that, I mean, we are looking at where the vulnerable populations are. The jails are one, just because they're in a confined space. Another is the homeless. And our third is those individuals who are in facilities, whether that's a skilled nursing facility, an adult care facility, an assisted care facility. And we are going to be meeting with them this week to have conversations about their plannings and their responses and how we can support them in keeping these individuals as safe as possible as well.
Have any county employees been tested for the coronavirus?
No.
Besides keeping in contact with them, what are some specific ways that the county's working with local providers to make sure everything stays under control?
Well, we're talking daily contact, at least daily. So they have their own response plans. We are making sure that the connectivity between our response plans and our first responders' response plans and the hospital system's response plans are all linked up so that we're communicating in the ways that we need to communicate. And we're trying to streamline that in a way that it's workable. So that we want to make sure that everybody has the information they need, but we don't want everybody spending all day, every day on email. So we have worked through those issues and are streamlining that communication to make sure that the right individuals have the information they need at all times.
About how many calls have you received to the hotline that was established?
It has not been extreme at this point. We've been averaging around 30 a day to the different levels of calls. I anticipate as time goes on that might ramp up. We're also, I think, part of the thing that has helped with that is having the website that has a lot of information on it, and we've been directing people to that site as well. We do know that 211 and 311 have been receiving some calls too, so we're making sure they have the information they need to be able to provide answers for individuals.
Just for a follow-up question, does the county take the lead when it is working with local healthcare providers? Like, who leads up? What
So
happens?
around this particular preparedness issue, County Public Health is the lead agency in the county.
We've been listening to a press conference from Mecklenburg County. The health officials talking about the coronavirus want to stress no confirmed cases, that we are in a very low, what they said was.
Thank you very much. Remember, calm. Calm.
Social media platforms. If you want to continue to watch it, you could watch it there. We'll have the very latest updates from this press conference for you coming up on the news at 4 o'clock today. I'll see you then.